Hello doctors, we just wanted to orient you because you will be moving up to the new PICU shortly. So I'm going to go through this department checklist if you guys can all look at it, and that way you won't be asking us where everything is. So this will be the new PICU nurses station. As you can see, there's a central monitor right here, which our Phillips rep is working on right now, but the nurses will be able to pull their patients' vitals from this central monitoring. It can include up to 3 waveforms, but we can make it bigger, so we can have end tidal here, we can have arterial line pressure monitoring, and of course we will have EKG, respiratory, and SAT functioning. But yes, so that will be there. There's 7 vectors or sectors in there, and we'll show you as it comes, but each room will have their own little area where you can see, and it'll be labeled to which patient is which. We'll put their names in and individualize that. The bed tracking will be the same, so it's the monitor?
Printer.
Oh, the printer, yes. Printer will be able to print EKG, not just strips, but the entire EKG, and we can look back up to 24 to 48 hours, so we can find a desaturation or event, and we can go ahead and print that EKG that went along with that event there. If you want to come up in the morning, you will see your patients in 609 and 611. Those are blocked off right now, but we can use a different color, maybe red, so you'll know which ones are the PICU rooms. So 609 and 611 are the PICU rooms, and then for surge or isolation, we have 607 that will be that will have a central monitor, and also 605 will have central monitoring capabilities that will pull to the central monitoring station. The med room location, you guys don't really need to know about that, but I'll just show it to you anyway. The PICU meds will be all brought up, and the PICU Pyxis machine will also be brought up. So the nurses will have access to all their emergency drugs, epinephrine, the RSI kit will be in here, the rapid sequence intubation kit. We'll also have a separate drug kit for patients that we are transferring from surgery up to here, so that will have epinephrine and all the emergency drugs that we have in PICU now. Okay, that's the medication room, and that's the Pyxis. So dictation, consultation, and work rooms, I'm sure you guys already know exactly where that is, but it hasn't changed. So that will be in the back. You guys will be sharing rooms with the peds doctors, which I'm sure you won't worry about. You'll also have the PACS viewing system that will be installed here so that you can see your CT scans and your radiology imaging. Next, we will go to the break area staff lounge. So don't bother the nurses on their breaks. Go to the charge nurse. But if you can't find your nurse and they say they're in the break room, this is the break room. I'm sure you guys all know where it is. It has lockers. It has everything. Your sleep room continues to be down at the very hall in 600. That's where the peds doctors have their sleep rooms. I don't know if you all know, but there will be equipment in those rooms, so pretty soon you will see a partition in that room. We will have probably the rapid transfuser in there, an extra ventilator, CAS cart. So our goal is not to wake you up, but if we have to wake you up, you should probably already be up anyway if we're getting the rapid transfuser or the ventilator. So stairwells, elevators, so there's 2 stairwells, once again, at the very end of the hall, right next to Natalie's office, and then there's an extra stairwell. I don't know if all you PICU doctors know, but it is right here. So 2 evacuation routes, of course, the one at the end of the hall, and then right here, where it says stop, emergency exit. But if it's an emergency and you need to use it, it's right here. PPE location. So you will have isolation carts, if you need them, right outside your PICU rooms in 609 and 611. That look the same as what the standard ones always look like. But we also have extra supply of PPE for some reason if you need it. If you can't find your nurse and you ran out of gowns, if you just go into the exam room right here and put 451, go in right here. We have extra PPE stuff that's not here now, but we will add. It's always here, and of course today when I'm showing you, it's not. Crash cart lives, and we'll be moving the PICU crash cart, which has a different defibrillator, up to the peds floor. So it will be directly across from your PICU rooms, which are 609 and 611. So the crash cart, the Brazil cart, is right here, which will have our brand new drill for the IOs, and it will have, of course, the defibrillator, and it will have the Braslow card just like we have downstairs. Backboard is on the back, full oxygen tank on the side, and of course, all the Braslow drawers. Fire alarm and pull stations and fire extinguishers. Right directly across from the break room is fire extinguisher, fire hose. The fire pull station is down here with the other fire hose. So if you're walking towards your sleep room, down the hall, that's the surge plan, 607, 605. We have surge, we can use these rooms for PICU. And then right on the other side of this partition here is another fire hose with another fire extinguisher inside. And then, I'm sorry, we walked past the fire pull station, which is in between the shower room and 605. So please don't pull the fire alarm, but if there's a fire, you can pull it. It's right here. Let me show you our handy dandy new PICU supply closet / respiratory supply closet. It's directly across from the exam room, or the treatment room we call it. And here it is. There's a spot for everything that you might need for your PICU patient. So just remember, right is respiratory. So the respiratory therapist is in charge. It has vent circuits, it has vapotherm cartridges, it has end-tidal, it has capnography, it has anything that you might need for your PICU patient is all here. On the left side are central lines. So on the top, when we move back up here, when we officially move up here, I'm going to change these to red bins, but these are all arterial line supplies. In the middle here, we have chest tube drains, adult and infant, procedure kits, LP trays, pigtails, central lines. These are could be subclavians or femoral. These are chest tube and Falquick chest tube supplies, all right here. Also, we have some extra things like suture removal trays, sterile drapes, stopcocks, of course, Surgicel, things like that. I'm gonna go ahead and bring you into the actual PICU room that's staged for a PICU patient. So 609 will be our main PICU area. So if we have a vent patient, we'll probably try to put him in this room as much as possible. So of course you guys know how to operate the beds. We can move them out, pull out the board if we need to do CPR, but they all have Trendelenburg functions, same kind of beds that we have in PICU. So this is a central monitoring that will be specific to the patient. These are brand new monitors and all the nurses got trained on them. There's a separate little monitor to take them transport, which is really nice. You can just pull it out. We're hoping to get the cartridge for the bottom so that we can use end-tidal CO2 monitoring on this. This is capable of showing 3 waveforms. So if you guys are more comfortable with the bigger monitor, we can also use that, but these are really convenient for, you know, taking a patient to MRI or something like that, because it shows 3 waveforms. And if it's after the 3rd waveform, you can have the sats in a corner, or you can have the heart rate in a corner, and you can put the CO2 waveform on this small monitor once we get that cartridge, hopefully. Call light system and the code white system is the same, kind of different. So if we have a code, there's this blue button right here that the nurse can push, and the call light system is the same. The patient has a call light right here, and they can push this if they need us. But what we have already discussed, if the patient is critically ill on a ventilator, the nurse will stay inside of the room. If you know it's a stable patient, they will be sitting at the central monitoring desk. Negative pressure system. 609 and 611 are not negative pressure rooms, so in our plan of we need a patient with a negative pressure room, we are going to ask him, but 607 is negative pressure, and that is set up with central monitoring. And code white we already talked about. In the treatment room, we probably won't be using that much for PICU patients because all of our treatments will be inside the rooms because they're sick patients that shouldn't be leaving. That's it. So please share this with your friends and come to a charge nurse if you need help finding something. Thank you.